It's called Incident Command for EMS. It looks at the role of the EMS provider in the command structure, from the everyday showing up at the station, making shift assignments, to the mass casualty incident, to disaster response, when the federal government resources are coming in, and also talks about how to prepare for these events and how to pre-plan buildings and be prepared on where you're going to set up in the incident when it happens. There are huge differences because you've got the patient to deal with, and in EMS a lot of the theory is once the patient's off the scene we don't need to worry about it, or our part's over. And I think the EMS provider sometimes forgets that they may be the first on scene and that most of our calls are patient care driven, that the decisions made are based on what's best for the patient in any aspect of the incident command structure. And it's a reminder that you have specific roles as an EMS provider in terms of beyond patient care, because rehab and medical care of the responders on the scene falls to the EMS provider when they show up. I think if they take anything away from the book, it's that if they practice it on a daily basis, no matter how ridiculous it may sound to get on the radio and mark on scene for a difficulty breathing call and marking command, it's that daily practice of incident command that's going to make it easier to just flow right in once you're on that large incident with 50 different apparatus on scene. And you can do it sitting around a table, you can do it in a full-scale exercise. As long as you're practicing it, that's when it becomes easier to handle.